Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita Valens, how are you today?
Terrific. Living it up. How about you?
Living it up. Why do anything else when you have the opportunity to change your own awareness?
There you go. That's it. So, what are we going to do today to help people get out of their orthopedic pain?
Well, it's what we do every day. We're interested in educating people on what stem cells and platelets do in the body, how they regenerate tissue, and how easy it is to get these treatments done. You basically walk in the office, you get your blood drawn or your stem cells taken and inject it back into the area that's bothering you. And it's something I've been doing with patients over 25 years since my residency at UCLA. But don't get mad at me if you're a USC fan, because I went there too. I've been to a lot of schools. I was at Northwestern University undergrad, and then I did law school in San Francisco, and then was a lawyer for about 15 years, and then went to medical school at the age of 40. And that was in pre-med and med school was in Hawaii. So I had a great 5.5 years there. Actually lived on the beach, so I got to surf all the time, which I loved. And then I got accepted to my residency at UCLA and continued even after that with learning about what is called alternative medicine or anti-aging medicine. I did a fellowship in that. So I'm pretty well-rounded in terms of, I forgot, I did a master's of taxation at USC. That's when we mentioned USC. While I was an attorney. At night I did that. So I've had a lot of education. It's something that's in my blood. I always, even as a little kid, I loved to learn. And I still am the same. I'm always looking. I love the internet because I'm always learning new things. Anything I think of, if I don't have the answer to it or I hear someone talking about something, I go look it up. And I learn all about it. And that's fun for me. That's what I like to do. So what I've done with my career in medicine is go from orthopedic surgery, which I was in training to do, to after a bad shoulder surgery on myself by my professor. And I have no blame for him. He was a great surgeon, and I used to go into surgery with him every day. And it just didn't work out, as surgeries often don't. So what I'm going to do is I'm going to open up the show now to people to call in, and we love to have you call in. Please do. Don't wait. Talk to me live right now. The phone number to talk to me is 866-870-5752. Get your pencil and write it down. 866-870-5752. And please, if you are driving, it's safer to pull off to the side of the road so you don't get distracted. We get a lot of callers who are driving. And if you can also, take off your Bluetooth and get off of your speakerphone so we can hear you very well. If you can't do that, then just yell at us and talk loud, and that's going to be good too. And for those of you that have questions we don't answer on the radio show here now, you can call my office and get a free phone consult with my staff. They're there now. And the number there is 800-300 9300. 800-300-9300. What kind of what?
What kind of questions would they want to be talking to your staff about?
Well, I'm going to get to that, Nita. You're chomping at the bit there.
I am. I'm excited.
It's all about how do you heal your pain without having a surgery? How do you take the surgery out of your pain? And my own experience has been that surgery did not work well for me, and 25 years of watching patients, I'm going to say, injured by having surgeries. So I'm not a fan. I love the surgeons. I just don't love a lot of the surgeries they don't do. There's so many studies that show that surgery can actually hurt people. And I know our culture is to do surgery, so it's difficult when everybody around you, especially these young kids on high school teams and college teams, when they have surgeons that work closely with them, and a lot of them end up with surgeries. And then the problem is, when it fails, what are they going to do? Then get another surgery? I don't think that's a great idea. I think a great idea from the get-go is think about doing regenerative medicine. Regenerative medicine is medicine that grows back the tissue. It can repair things like meniscal tears, rotator cuff tears. People that have herniated discs in their back, that doesn't mean that's causing you a problem. Be careful not to get a surgery if you can help it by just getting a few regenerative medicine injections with your platelets or stem cells. They regrow the tissue. I don't care what it is that your diagnosis is. I don't go by diagnoses. I find that most of my patients that come to me have seen other doctors come in with the wrong diagnosis. Why is that? They get images done, MRIs, X-rays, CT scans, and then the doctor slaps that up on the light board and says, hey, look, you got this problem. Well, what I find is that using my hands finds the problem, and that the images often direct you in the wrong direction. So be careful. So if you want to get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, please call us live right now at the studio at 866-870-5752. Don't be shy. Don't wait. Get your answers right now. You can ask me any kind of questions about orthopedic medicine, about how surgery works and how it doesn't work, and how your injuries or your arthritis can actually heal with simple injections. Does it work on everybody? No, nothing works on everybody. And regenerative medicine fails most often because people don't let the healing take place after the injections. They're too active. And I raise my hand to being one of those people, and it's frustrating for athletes like me and a lot of you guys to sit back and let things heal. But that is something that will block the regeneration of tissue after injections if you don't let it heal. You got to sit back and wait sometimes. Another failure is because of taking anti-inflammatory medications, and those are medications like ibuprofen. What's the problem with that? They block inflammation. So, for instance, if you sprain your ankle and it's swollen and you don't like that, that's too bad. That's how God made the body. The inflammation brings fibroblasts to the area, and those are cells that bring healing. They grow back the tissue. So be careful. I tell my patients to stay away from anti-inflammatory medicines. And then another failure, and we just had a terrible Yelp review from a very nice patient of mine about how he didn't heal after 2 treatments. No, actually he didn't say that. He said he did heal. And I looked up the note. He was about 100%, 98, 100% better. And then he thought the healing went away. It didn't go away. He just didn't grow enough tissue yet. So that's often very common. A person will get better, and then they'll blow it out. You know, if it's a person that has back pain, it might be from doing squats or playing golf too soon, something like that. because there hasn't been enough tissue that's healed. You got to give it a chance. Another reason for failures with regenerative medicine is doctors who don't use ultrasound. That's the kind of ultrasound where you can actually look inside the body. So what we do is we use the ultrasound to guide the needle. We can actually watch where the needle is going. And an example of failures back in the old days before ultrasound, when we'd have national meetings on regenerative medicine, we'd all wonder why hips didn't heal. And the answer is because we weren't putting the needle in the right spot to get it into the joint. We used to come in over the greater trochanter, and that's a very low percentage of getting a needle into the joint. Same thing with knees. There are studies that show if you don't use ultrasound guidance, there's a 33% chance you're going to miss the area into the joint that you're trying to get to. So if your doctors are injecting you, I don't care what they're injecting you with, make sure they're using an ultrasound. And then the fourth reason, if it is the fourth or fifth, is if you get someone who's really not trained in regenerative medicine, they go to a weekend course and hang their shingle saying they do stem cells or platelets, be careful. You got to find the guy who does the most. And right now, I think our clinic does the most of anybody in the world. Dr. Thomas Grove is our new injector, and he has trained for over 10 years and is really a master in ultrasound guidance. And you can look him up on our website at www.jointrehab.com. There's photographs of him, a lot of videos of these procedures being done. It's a great website, and there's a spot on every page where you can email me. We get emails from all over the world every day, and I answer all of them. So I'm looking at the board here, and there's Gary who says, are stem cells the best option available? So, Gary, let's find out what's going on with you, and then I can answer your question. So thank you so much for calling in. Well, I just got
hopefully it's a simple question.
Sure.
Are internet stem cells snake oil?
I don't know what internet stem cells means.
Oh, just, you get an email saying, hey, I got a bunch of stem cells, and we'd like to sell them to you.
Okay.
But what happens after that? I think you kind of answered my question. I wouldn't know where to go if somebody sent me a bag of stem cells for the reasons that you just gave. I
don't know of any site on the internet, because it's never come to me, and I get all kinds of stuff every day about stem cells, where they're actually going to sell them to you. It's possible there could be something like that, but it's
every once in a while I get an email.
Okay.
And I'm really not reading it because I don't, I'd rather be in touch with somebody locally here than just, buying my stem cells from, stem cells and.
Well, let's say you
Transmission Exchange.
Let's say you bought some stem cells. I don't know how you're going to do that, but let's say you did. What are you going to do with them?
Well, that's what I was just saying. What do I do? Take them to my local doctor and say, have at it?
Well, first of all, I don't even understand the concept of buying stem cells, so I'm having difficulty, unfortunately, answering your question. What you can do, if one of these comes to you again, you can email me through my website at www.jointrehab.com and give me the information, and I'll call you up. I'll get right back to you.
All right, and it was
www.jointrehab.com.
Very good.
Yeah, and that's the name of my clinic. It's Joint Rehab and Sports Medical Center. We're in West LA, across the freeway from UCLA on Wilshire Boulevard, and it's very easy to get to. It's right off the 405 freeway. So, what is it that, Gary, do you have some part of your body that is bothering you? Is that why you're interested in this?
Well, I had back surgery, and I guess I didn't do enough exercises because my back still hurts.
Okay.
That would be the biggest, the biggest challenge I have is getting my back to where I can walk around the block without stopping.
Okay, so I have some hopefully good news for you. I can't promise you anything, but we treat back pain every day.
Right.
I think most of what we do, most common is knees, then shoulders, and then low backs, and then necks, and we do the whole body, from head to toe. There's no part of the body we really don't do, so you have what we call a failed back syndrome. And that means you had a back surgery that failed. Okay? Very, very, very common. In my experience, about half the back surgeries fail in time.
Wow.
So I'm not saying that to put down surgeons, because I love surgeons.
No, right.
Yeah, I think they're, they've got to be the smartest and toughest guys in medicine to do what they do, because there's so much danger involved with it. And I've seen people die from surgery. I've seen people get infected. I see all kinds of things. So you got to have a tough innards to be a surgeon. There's no question about it. A lot of people in med school want to become surgeons, and they do surgical rotations, and they go, I love it, but I don't have the guts to do it. So my hat comes off to the surgeons.
Okay, last issue, if I could. The back surgeon put in spacers.
Okay.
Does that affect how you'd take on a case?
No, we have a lot of cases every day that are post-surgical, meaning people have had a surgery and it failed, and then they come in. We can still help with most of that.
Okay.
And the only way,
doctor.
Honestly, Gary, the only way we're going to know, we have to touch the body.
Right.
In 1 second, I can tell you if we can help you or not. I don't do it based on your MRI or your CT or your X-rays.
Well, believe me, I've been listening to you for a long time.
Okay, good. Well, I'm glad that you finally called in, and because this is good information for people to understand that if your doctor and I ask all my surgical failure patients who come and I go to the surgeon, touch you. And they say no, they just slapped up an MRI or an X-ray on the light box and showed me where the problem was. And to me, that's
what happened.
Yeah, to me, that's poor medicine. They were never touched, and the surgeon never actually found out what the pain generator was. Because we know that if we take people that have zero pain and we do images of them, we're going to find something that looks terrible. Everybody. Okay? Does that mean you go get a surgery to fix something that doesn't bother you? No. So the problem is, let's say you have pain in your back and you get an image and it shows something. Does that mean the pain is coming from where that image shows there's a problem? No. And we have that conundrum to deal with every day of our medical life in my clinic. Dr. Grove and I have to spend most of our time educating people that you can't decide where pain is coming from by looking at an image.
Okay. Well, that's what he did. I looked at an X-ray.
Well, look, I'm not blaming the surgeon, because that's the surgical culture. That's what they're trained to do. I was trained that way. I did a lot of orthopedic surgery, and that was the training. Get the image and then find out what's wrong with it and then try to fix that. Well, you can fix something that's not wrong with you, and it doesn't help. It's not the pain generator. Does that make sense, Gary?
Yeah, it does. I mean, when you open up anybody anywhere, there's a risk of, as you stated, infection, bad medical practice, things like that, where I would think injecting stem cells, they're part of you, so there shouldn't be any rejection.
No, there's no. I've never had rejection. I've been doing this, probably stem cells for the last 15, 18 years or so, and platelets before that, PRP. So, yeah, I've never seen any rejection. I've never really seen any real issues with it. Sometimes people get stiff after the injection for a day or two, sometimes longer. But that's part of the process of creating some inflammation, which we want to do. Sometimes people don't feel anything afterwards, except heal, or sometimes they don't heal. It's not going to work on everybody. This is not a panacea for all healing. It's just something that seems to work quite a bit. And if you've been listening to this show for a long time, you've heard my stories. I had a surgery on my right shoulder that failed miserably. And then I was 4 years in misery with lack of range of motion and terrible pain. And then I injected my own shoulder, and it was healed by the next morning.
Wow, yeah.
But it doesn't always work like that. I've been very fortunate with regenerative medicine and healing both of my knees, both my elbows. I had tennis elbow on both of them from weightlifting and playing tennis. And the knees still have meniscal tears, but they've healed up quite a bit in terms of imaging. I look with an ultrasound every once in a while. There's still tears there, but I don't have any pain. I run in the mountains almost every morning before I go to work. And, yeah, up and down hills. And
I'm sorry, I don't mean to laugh at your... I don't have any mountains around me to run up.
Well, it's not steep. You know, it's not steep.
I know.
I mean, some of it is,
but I can see you and Heidi running up the mountain there.
Well, my puppy's name is Bella. We lost Dakota this summer. I used to put their leashes together, and they'd pull me up and down. But now Bella is here with me, and we still run together. And she's 12 years old. That's pretty old for a husky, but she loves to run, and we have a great time. So hang with me, Gary. I'm going to give out the phone number again because I love talking to people instead of just blabbing myself or with Nita. And the phone number to talk to me live right now, like Gary is doing, is 866-870-5752. That's 866-870-5752. And for calling in, we're going to mail you for free. I'm going to pay the postage. It's about $8 for postage. I pay that, and I'm going to send you out a book. It's a $25 book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got about 200 pages, about 250 studies on regenerative medicine of stem cells and platelets, how they work, the science behind it, and how surgery is starting to fail people. As we get more educated from the internet, less and less people want surgery. Thank God. You know, surgery is necessary sometimes. There's no question about it. But when it comes to things like taking tissue out, pulling out the meniscus, going in and cutting tissue out in the shoulder, all of these things, shoulder replacements, hip replacements, labral tears, it just makes no sense to me why surgeons are still doing that. And I apologize. I'm not bashing the surgeons. You know, they have their culture, I have mine. And they could probably laugh at me. You know, I have a lot of orthopedic surgeon friends because I do refer some patients to orthopedic surgeons when it's things that I think are necessary. It's pretty rare, but when I talk to the surgeons, we want to punch each other out. So, Gary, if you want to hang on, we're going to a break. I love talking to you. And for people that want to call in after the break, the phone number to the studio is 866-870-5752. And if you want to call the office right now and get a free consult with my staff, free phone consult, the phone number is 800-300-9300.
And we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.